The Immunisation Coalition is a not-for-profit organisation which has an aim to maximise the health of all Australians by promoting immunisation across the age range. Our target audience consists of the general public, particularly vulnerable groups like the elderly, the very young, pregnant women and those with chronic diseases, but also the media who share information and fellow health professionals. The coalition arose out of a group of people who had previously been involved in the influenza specialist group, looking to expand the advocacy work that they'd been doing in influenza to other diseases and to other age ranges. We believe there are opportunities to improve vaccination coverage across the age spectrum. We know that we need to do better with a number of vaccines in our elderly. We know that we don't do particularly well in making sure that pregnant women have received influenza vaccine and pertussis boosting. And we know that there are some issues, particularly influenza vaccine in children, where we really have not managed to improve the background coverage rates. The organisation seeks to maximise collaboration between ourselves and like-minded bodies. We're seeking to work with other Immunisation Alliance groups and other health professionals with an interest in vaccination to try and maximise the available resources. All of the work developed by the Immunisation Coalition is free intellectual property. We encourage other groups to work with us and to use the resources we develop with their own branding and in their own settings to improve immunisation coverage. Education, particularly with immunisation providers, is a key focus of where the Immunisation Coalition is going at the moment. We have already commenced projects with MD Briefcase, an online GP medical education program, funded by public health units and primary health networks in order to provide special communication skills for general practitioners looking particularly at vaccine hesitancy and parents that are concerned about the number of antigens, the potential for autism or any of the other hesitancy issues that are currently circulating on social media. We are also looking to improve the collaboration broadly with primary health networks across Australia, public health groups and other vaccine supporter groups. We believe there is a lot of wonderful work happening across Australia in things like technological enhancements using text messaging for recall systems, combining different systems to look at adverse events to make sure that we document and that we're able to report on safety, and various other advances to enable us to run quality immunisation programs across Australia. But too many times these programs are underfunded, competing with each other and starting from the same baseline when a collaborative approach would actually lead to a better overall Australian product. So far, the majority of the funding for the Immunisation Coalition has come from the public health unit, primary health network setting. We're seeking to expand our funding base. We want to work with government organisations and with other groups interested in immunisation. But our core role, we see, is to improve collaboration and to improve the availability of high quality immunisation information so that all of us can work to improve the coverage of vaccines right across the age spectrum in Australia.